Japan has widened COVID-19 curbs in Tokyo and across a dozen regions. Half the population could be affected by the new controls. The quasi-emergency begins on Friday and will last until the middle of February. Local governments will be allowed to limit movement and business activities to try to stop a surge in infections. Michio Ishida with this report.
Some local authorities and business leaders are unhappy with the tightening, concerned about its impact on the country's economic recovery. This, as data suggests, the current wave of infections is not as severe as the previous wave. So far, the Omicron strain is spreading mainly among young people and through big social gatherings where people tend to speak loudly while eating in poorly ventilated space. There are limited reports of COVID-19 deaths, and those in serious conditions are about a tenth of last August, when Japan saw the peak of the fifth wave. With only 1% of the population having received booster shots, the government is concerned that from its younger population, the virus could reach its elderly and overwhelm hospital beds, which are filling up. Now, the central government has approved their request to impose a quasi-state of emergency. It will leave it up to the governors of each prefecture to decide on the exact measures they will take to curb the spread. Although the government's chief COVID-19 advisor, Dr. Shigeru Omi, has recommended that big gatherings like parties should be avoided, the group sizes for gathering and dining at restaurants should be capped at 4 people during this period. In the coming days, more prefectures may follow suit and request to tighten COVID-19 measures in their areas. Osaka, which reports the second highest COVID-19 daily count, together with Kyoto and Hyogo, have indicated that they will consider imposing a quasi-state of emergency once the occupancy rate of hospital beds reaches 35%. Michio Ishida, CNA, Tokyo.